Welcome to No Filter Doctor, where we cut through the health hype and dig into what's real, what works, and what's backed by evidence. I'm Dr. AK. Let's get into it. Hey everyone, welcome back. Thanks for joining me again today. We are going to talk about heart rate variability. It is a metric that is on a lot of these biometric devices that we wear, whether it's a ring or a watch. You get this report about your HRV. You get a little alert, maybe it's too low, maybe it's in perfect range, but what does that mean? What is an HRV? What does a low or high HRV indicate? How did they even determine these perfect ranges? These are the things that I want to get into today, so if you are wearing one of those devices, you can maybe use the data rather than just kind of look at it and wonder wonder what this is. The one thing that I do want to say before we move along is that I clearly sound like a frog, and that is because I have a cold, but the show must go on. If I don't record, then we don't have podcasts, and so many of you are joining me, and I'm getting new followers, and if I miss a week, that's a big no-no. So hopefully you can get by my Kermit voice and find value in this information. Without further ado, heart rate variability. So what is it? Well, the first thing that we have to cover is the fact that our heartbeat, we often think of it as this very regular and rhythmic, like lub-dub, lub-dub. It is not actually exactly that way. It's not a metronome. Like, it's not that machine that people use that keeps a beat for you to play music to. And things are not on this fixed exact time interval. There are very, very small measures of change between each one of those heartbeats, and that is dependent on so many different contributing factors. The change in those intervals between each of those heartbeats, that is what is referred to as heart rate variability. And the thing that I find most interesting about that is the fact that heart rate variability gives us insights to our autonomic nervous system. And so now many of you may be asking, what on earth is that? So let's talk about that. Because I don't know everyone's background and I want to make sure that no one misses this information, I'm going to try and explain this in the most simple way. It's not being condescending. It's actually being inclusive of everyone, because I don't know that when I use medical terms, everyone exactly knows what I'm talking about. So the first thing we need to know is we have two main nervous systems that contribute to our peripheral nervous system. One is the somatic nervous system, and the other is autonomic nervous system. And yes, I realize I just said nervous system like 900 times. But the somatic nervous system is our voluntary one. It's the one where you say, I want to get up from this chair and walk across the room. I want to move my arm. It's things that you can control. Our autonomic nervous system is not so much under that same control. That's things like digestion, your heart rate, your respiratory rate. And yes, you can do certain things like breathing techniques to control some of these things in terms of your heart rate. And yes, you can choose to hold your breath and control your respiratory rate. But for the most part, those are done without direct consciousness. The autonomic nervous system is then broken up further into two more systems. One is the parasympathetic nervous system, and one is the sympathetic. The parasympathetic one slows down things. It's like our chill one. Your heart rate lowers, your blood pressure lowers, you digest your food, you sleep. That's when parasympathetic is in full force. The sympathetic is the exact opposite of that. That is like, it speeds up your heart rate, it increases your blood pressure, it helps you with fight or flight. Neither system is better than the other. They both work together to keep our bodies very regulated and adaptable. And HRV reflects how this system is working. So basically that metric is a representative of your autonomic nervous system and how well it's working between the parasympathetic and sympathetic balance. So what does that mean with regard to our overall health? There are a lot of different conditions that can influence our autonomic nervous system and how it works. There's different neurological ones like traumatic brain injury or Guillain-Barré syndrome. There's different autoimmune and inflammatory conditions such as Sjogren's syndrome or chronic fatigue syndrome. There's metabolic things like diabetes, perimenopause, and menopause. I mean, anyone going through that can probably give several examples of how their autonomic nervous system is not working well with itself. Other causes like infection or toxins can affect it. There's also cardiac conditions, things like POTS or neurogenic syncope. And then there's a lot of influence in terms of lifestyle factors. So like physical inactivity, poor diet, really high levels of stress that people don't know how to address, excessive alcohol use, smoking, like all of these things can influence the autonomic nervous system. HRV is a reflection of all of that and gives us a little bit of insight of where to go digging whenever our levels might be too low. So how does it do that? Well, the heart rate and how well the heart squeezes, it's all modulated by the autonomic nervous system. In a normal, healthy condition, the sympathetic nervous system is more dominant. It's the one that is almost always constantly on. And it's up to the parasympathetic nervous system to come in and be like, yo, chill out, man. And there's these continuous physiologic variations in that balanced system. When people are dysregulated, the parasympathetic nervous system is not able to have that influence on the sympathetic nervous system as much. And then what happens is there's not as much variation. So this is where that HRV comes into play. That variability between our heartbeats, and when it's high, it means that our autonomic nervous system is balanced. But when it's low, it indicates that there may be something off. Studies have linked HRV to cardiovascular and overall health. There was a meta-analysis that looked at the relationship between HRV and cardiac events, and it found that people with a low HRV had an increased risk of cardiac event without any prior history of cardiovascular disease. There was another meta-analysis that supported that finding that there was increased risk of cardiac events with low HRV. In addition, it found an increase in all-cause mortality in people with low HRV. And then there was a much smaller study that found an increased risk of cardiac death with low HRV, and that when you had incremental decreases in HRV, that risk went up. Now, before everyone with a low HRV starts freaking out and says, oh my God, I'm going to have a heart attack, let's just pause and talk about this for a second. We've talked multiple times about confounding variables. Now, I went through very briefly and gave you some of the different things that can influence the autonomic nervous system. And some of those are lifestyle factors. So again, physical inactivity, poor diet, obesity, chronic stress that you don't know how to address, not sleeping, smoking, excessive alcohol use. Those are also things that can increase a higher risk of cardiac death. So those confounding variables weren't exactly teased out in all of these people. You may have a low HRV for a totally different reason. That doesn't necessarily mean that, you have nothing to worry about, but it also means you're not necessarily going to drop dead of a heart attack. So don't freak out. It just means you got to look into things a little bit to see if we can figure out the reason why behind it. This is one of those metrics that when we understand what it means and we understand how to use it, it may then contribute to our longevity. So this is why I'm going through all of this, and not to freak you out that you're going to drop dead of a heart attack with a low HRV. Let's talk about how it's calculated. So I'm going to spare you. There are math and algorithms and equations, and even though I loved calculus in high school and college, this is not a mathematic podcast, so we're going to skip over all that, and I'm just going to tell you that an EKG is the gold standard for measuring heart rate variability. And even with the EKG, there's a lot of debate on whether you need a 24-hour one, whether 2 minutes is good enough, whether 30 seconds is good enough. There's something called a Holter monitor, which is kind of like this wearable EKG. And so most of the studies that are using a gold standard measure, they're using that. They're using a 24-hour Holter monitor as the gold standard measure of an HRV. But that's not necessarily feasible for all of us. Like I can't just walk around with electrodes for 24 hours to get an HRV. So we have these other devices that we can use, but they may not be as accurate. So I own 2 separate wearable devices, and I get all this data and metrics. One of them is a watch, one of them is a ring. HRV is offered on both, and there's about a 20-point difference between the 2 readings. And one reason is because most of these wearables use something called photoplethysmography. It's hard to say, I'm not going to lie. And so it gives us an estimate rather than using the EKG. A lot of it has to do with light. If you look under your watch or your ring, you'll see these little green lights and they flash, and sometimes there's red. And it's using that light in order to measure that variability. But there are some issues that come with that technique. First of all, the technology is different. The lights aren't the same or necessarily really good in all of these different devices. And even the ones that do have good technology, things get missed. Rings move, watches move, sometimes it's not in contact with the skin. And this often leads to an underestimation of true HRV. There was a paper that came out in 2024 and looked at this exact question in Apple Watches, and it determined that, that Apple Watch underestimates the HRV pretty consistently. If I remember it correctly, in some cases it was up to 15 points of an underestimation. So that's pretty significant. And when I have patients who talk to me about their HRV, one of my very first questions is, well, what are we even using to measure it? How is it being measured? Another reason for this is the math. Like, I know I said I wasn't going to get into details about the algorithm, but I will tell you that some devices use what's called an SDNN method, and some use an RMSSD method. And that has to do with whether they're using the square root of something or whether they're measuring R to R intervals. And so, again, nothing that we're going to cover in great detail, but if you're curious, you can look it up. In every single one of these podcasts, I usually have a link to a blog or something else that gives you additional information. And I have some papers that are referenced. So if you are dying to know the math, you can absolutely go look at that. Now, just because these devices are not quite as accurate, that doesn't mean you completely wasted your money and you should throw them all out. There is some valuable information in it. But one of the key things is that these, quote, normal ranges and average ranges that the devices are saying, it doesn't have the same meaning for everyone. As is the case with many biometric measurements, HRV is very dependent on age, sex, race, level of fitness, diet, sleep. So whether your HRV is normal or not, it really depends on the context. And I spent a significant amount of time trying to find papers and charts that give me this beautiful list of, if this is your age, or this is your sex, if this is your race, if this is your level of fitness, this is what your HRV should be. And unfortunately, that does not exist. A lot of these different metrics, like watches and rings, they've kind of done their own research, and through their own mathematical analysis have come to a conclusion of what they think are healthy averages and measurements. And it might not necessarily be the same ones as the HRVs that are reported using a 5-minute EKG, because I did find a chart that has that, and that is also in the blog on HRV that goes with this podcast. So you can hop on and look at that and basically see, based on your age and your sex, what percentile are you in with your HRV. The only thing that I find actionable about any of these is if someone is in the 25th percentile or lower. And the reason for that is that lets me know as a physician, okay, this HRV is pretty low. And I know based on some of those other studies that there is an association with higher mortality, even though I'm not exactly sure what the causation or exact connection is. I know it exists, so let me do some digging into things that I know cause a low HRV and see if we can work on this. So obviously, the first thing I'm going to do is, hey, is there a medical cause? I mean, we talked about menopause and perimenopause. If someone is experiencing that and they go on hormones, I'm going to see, has the HRV trended to a more positive direction, right? But a lot of this is also nuanced. Sometimes it's not that easy to find a medical cause, and you're all going to call me a broken record, but the fact of the matter is that lifestyle plays a huge role in HRV. This is one of those metrics that you can actually control. Things like regular physical activity, different relaxation techniques. There are some biofeedback things that people can learn, getting better sleep, eating whole, nutritious foods. All of these things influence HRV. Exercise has a profound effect, and it's all of them: aerobic, resistance, HIIT training. All of those consistently increase HRV. There were multiple studies done and showed that whether people are healthy, whether they have cardiovascular disease, exercise improves all of them. And a lot of it has to do with enhancing that parasympathetic tone that we were talking about before when we discussed the autonomic nervous system. There's also different relaxation therapies such as progressive muscle relaxation, meditation, yoga. There's different breathing techniques. All of these have been shown to increase HRV as well. There are also a couple of studies that demonstrated weight reduction and, again, eating a diet rich in like whole foods and highly nutritious foods, and restorative sleep. Sleep is huge. And all of those, if you improve them, you can improve your HRV. And so while HRV is not perfect, I do find it useful. And I think it's a valuable data point to kind of give you some insight on overall health, but interpreting that requires nuance. Like, for example, that absolute number in isolation, I don't know that it really means that much. I think it's really important to trend it. Now, if someone, like I said, is in the lowest percentile, I may want to do a little bit more digging. But I do think HRV is valuable enough that I purchased an EKG machine to do these 5-minute measurements in the office to get an HRV on people. And I do track them and trend them because I do think it's important. I also think that looking at your HRV and looking for outlying measurements is a good clue that something is amiss. I mean, the perfect example is when I was putting the blog together about HRV, I was traveling for a conference. And I just don't do well when I travel. I don't sleep well. My diet is off. I might have a couple drinks with people in kind of a social capacity, and I don't really do that on a regular basis. I'm still exercising. I'm still doing the best that I can to eat, but not every restaurant is going to have foods that I know are typical to what I'm used to eating. And so my HRV tanks when I travel. When I'm giving talks, my HRV drops a little bit because I get a little bit nervous, right? So there's that sympathetic surge, and so that HRV goes down because the variability goes down. And so when I see that my HRV is low, I just go through a checklist of different things. And that's what I do with a lot of patients. When their HRV is low, we go through a checklist of different things, and I ask different questions, and I try and find out what it could be for that individual, and then we make small little changes and see what happens over time. I genuinely feel like it is a good marker to keep track of over time, and it helps give us an insight on someone's longevity and overall health. And so for those reasons, I felt it was important to discuss the concept of HRV and give all of you insight on what that number is that is showing up in your different apps. It's definitely nothing to freak out about. I don't think you should see that you have a low HRV and just kind of go into this sympathetic surge worrying about what's going to happen to you or what your mortality looks like. But it is something to get you thinking a little bit about, hey, do I need to do lifestyle modifications? Hey, do I have a certain medical condition that might benefit from some medication or a physician evaluation? And it's just one more thing for you to look at to start that discussion with your doctor or other members of your healthcare team. Thank you so much for joining me on this week's No Filter Doctor. I hope you enjoyed the content, and if you'd like to follow along outside of the podcast, you can follow me on social media. I'm on Facebook and Instagram. There's also a YouTube page. If you want to join the newsletter, You can do that on www.thewholehumanhealthandwellbeing.com. That is my medical practice. The other thing that I want to make sure everyone knows that even though I am a doctor, I'm not your doctor. And so the things that we talk about on this podcast, they're not really meant for you to take as medical advice because no doctor-patient relationship has been established between us. I also don't want you to delay care. If you have any questions about anything, you should absolutely present to your healthcare team, ask those questions, and do not delay any kind of treatment or getting any answers to any of your questions that you need, especially based on this podcast. This is just for general information and education to give people to start those discussions with their healthcare team. My only financial disclosure is my medical practice that I mentioned earlier for the newsletter subscription. Take care, everyone, and I will talk to you next week.